Thanks, Harry. Thank all of you. I'm very happy to be here. Let me go very directly to this session. Probably, if I have no time, I will begin with the conclusions. Spanish NHS, that is a very well reputation and very well considered, is facing an overwhelming challenge. The economic crisis that began in 2008 is the biggest challenge since its origin. The institutional weaknesses of the NHS, the Spanish NHS, raise serious uncertainties about its sustainability. Nowadays, the domain is pragmatic macroeconomic adjustment, cutting budgets and inputs in the system. That is what is happening. The ideological biases are getting into policy, the liberal way of reduction the state and to diminishing the solidarity. That is one of the complementary problems we are facing. And finally, the hurriedness and the rupture of the political and social dialogue might disrupt the need of a reform agenda. That is all the basic issues we are concerned. Let me just very briefly say that the history of our NHS, National Health System, comes from social security, is Bismarck origins, towards universalization, towards a more NHS, a beverage-type system. But, and it's very important, the reaction in these years is going back to beverage inspiration. Therefore, cost containment last year was made in, let me say, more classic style, managed by the Socialist Party, but the Popular Party in this year, the Conservative Party, have go back to a more Bismarckian approach. Sustainability is a key issue. Let me give only a flavor of the situation of Spain. I mean, our problem is here. We have a problem of deficit financing of the expenditures. I mean, we have more expenditures than taxes, and that is a very historical problem. We don't have a large debt yet to now, though it's increasing, but we have a problem of imbalance of what we get and we spend. The forecasts are not positive. We see that GDP is not going well. We are getting into recession. We see that our big and distinctive characteristic, that is unemployment, maintains or even rise in different forecasts. We are not only good in football, we are very special in unemployment. The stability plan forecasts that the public debt will be rise at least until 2013, and probably will take a lot of years to rearrange this figure. Therefore, the current situation of the Spanish economy is not good. We are following, like Portugal, many of the prescriptions of the orthodox prescription, but they are not going well. The deficit of different levels of public institutions in Spain are really important, but see this area, this pink area, the debt of the regional authorities, the comunidades autónomas, autonomous community, that leads with education, health, and social services. Therefore, we are having a problem of under-financing of the most important and basic tools of the welfare state. They are not evenly distributed in the different regions, but, well, we don't have time to go in depth. Therefore, second, we can say that we are taking the wrong way in welfare, health, and healthcare. There is a classic prediction of André Sapir, when they say that there were four typologies of European economies: equity and efficiency. Mediterranean seems to be low in equity and low in efficiency. Probably Nordic countries were high in equity and high in efficiency. What it seems is that European policy are doing that we maintain low efficiency but even lower equity. Therefore, what is happening in Spain is a severe cutting of expenses in all levels of the Spanish public sector: national, regional, municipalities. And the forecast, the plans of the government is towards 2015, go down the GDP in health from 6.5% of GDP to 5.1%. Therefore, that's what we call unacceptable cuts. That means also, that means also that going from 6.5 to 5.1 is a change not only in the amount of money, it's a change in the type of system we can provide to our citizens. A lot of policies have developed along this, let me say, 2.5 years. The first were issued by Socialist Party. This is Happy Zapatero. He began to be less happy. Then comes Happy Rajoy. He begins to be less happy. Now he's surprised because the financing of the debt have he thought that the coming would be enough to give safety, and the polls of elections are not good for the government, but they are not good as well for socialists. So there is a dropping in all classical parties. Therefore, the health policy response are I don't go in depth, are the same stuff, the same issues, going to pharma policies, energetic, big goods policy of generic, change in price and whatever. They are very... Regional policies are more diverse because they have a lot of financial pressure. Therefore, they cut in expenditures, in pharma, they reorganize provision, especially in Valencia and Madrid, two regions, where the government, regional government, is particularly liberal, are particular against the public provision, against the size of the state. Let me say, probably in other parts of Spain, other regions, conservative, the Popular Party, are not in that way. But there are important increase in activity cuts, surgical theaters, beds, external contracting of operation, diagnostic and other, stop additional surgical sessions for waiting list initiative, of course, more waiting days than the legally warranted, the guarantees. And probably this is important, the strategic reforms are stopped. Managerial reforms, chronic patients, clinical management, integrated care. I mean, even this very well reported to do disinvestment of those interventions not effective. All of this is in the rhetoric aspect, but it's very difficult to advance. We are dealing with a very complex and conflictive scenario. Basically for that, there is a royal law, or the decree law, that changed new issues to the Spanish healthcare system. It's supposed that it's a very important law for the sustainability of the National Health Service, but in fact drives several measures to reduce the breadth which is covered. Immigrants are heavily take out of normal care, only emergency care. Also the scope, which benefits are covered or not. Not yet are taking out benefits, but they are classified in different type of benefits of services. And finally, copayments. Copayments for medicines. Today they have put copayments also for ambulance care. It's a new measure. And the idea is not making cost sharing in medical clinical service, but put cost sharing for supplementary benefits and accessory benefits. Therefore, now pensioners, old people, have to pay for medicine for the first time in our history. There are a small amount with monthly caps, with some exemption, but this is not popular. But I mean, what people are more worried is what happened in the future. And second, there are no income protection for active people, not for pensioners, no limits, no caps. The average expenditure per capita began to drop. This is the peak in 2010 and began to go down. That is per capita public expenditure in the initial budgets. We have to look at the end of the year, how is going on this initial budget. And we say in our analysis in Spain that there's a tension between what we can term external sustainability, the money that the society, the government puts for healthcare, and the internal sustainability, the efficiency, and the action that we can take for improving the effectiveness, quality, and whatever. The problem is that government is saving banks, but is dropping healthcare. And people are very angry. Why we have to make economies, tight economies, when most of the money goes to save the banks? There are other strategies. In Spain, there are several societies of public health, health economy, and they are doing a huge effort to suggest different good strategies of structural changes for dealing with the crisis. Let me finish with some final comments regarding the view from Spain to the problem of the European Union and the southern countries. Let me say, the governments of Ireland, Spain, and Italy have internalized the Troika tenets and are following the same path. We don't have yet an intervention, a bailout, but the economic policy is almost the same. We think that the Troika-like health policies have a dramatic effect in cuts, their nature and their hurried implementation. Of course, we know, we are aware that we have fat in the healthcare service, but the cuts proposed reach their very skeleton, their structure. We are cutting quickly and sharply public resources. As they are implemented hurriedly with arrogance, right across the board, and without professional input and technical expertise, they are counterproductive. Far from promoting value for money, they block the prospect for a much-needed social contract between health professions and the public healthcare system, to disinvest in low-value intervention and reinvest resources in patient and services without clear gains. The risk is to end up with a weak, market-driven healthcare system with bad consequences for health, welfare, and economy. And we think, that's the last slide, that Europe has the moral obligation to support. There must be an opportunity for opening a new reformist space of good governance and developing strategies for the internal sustainability of the European public health systems. There is a demand that many of us address to the European public opinion and policymakers. We all need it if we are to live in decent and healthy societies. And this, please give good health reforms the chance they deserve in Greece, Portugal, Ireland, Spain, and Italy. Thank you very much.
Thank you.